medications that are going to affect the wound healing phases. So wound healing starts with hemostasis, which is that coagulation to stop the bleeding. So anticoagulants will increase the risk of bleeding and affect this process, including those common anticoagulants and aspirin as well. Inflammation is the next step, and it's often overlapping, and that can happen within the first 5 days of a wound being sustained and open. So you may have red granulation tissue, but you may also see a bit of fluid. You may see also a bit of slut that comes to the wound bed. But that is a natural part of the wound healing process, and we also get fibroblasts. So fibroblasts are our friends. They help us close the wounds, and they help us build that new red granulation tissue, and that's what they're made of. So NSAIDs inhibit prostaglandins, which help reduce the inflammatory process, which is great for pain. But in wound care, we actually need a wound to go through this natural inflammatory cascade so that we get these immune cells like macrophages and white blood cells to come in to clean up the wound bed and create a little bit of fluid for moist wound healing. So medications such as aspirin, ibuprofen, diclofenac, piloxicam, celecoxib, all of these can affect the wound healing process and delay the healing. Corticosteroids such as prednisolone and immunosuppressants, there are lots of them these days that patients are using for various conditions. All of these ones can reduce the immune response, which we do need for the body to heal naturally. Proliferation is the next phase, and that can take up to 21 days or longer. And this is where we get a lot of that buildup of new blood vessels and new blood cells to create new granulation tissue, epithelial tissue, and contract from the edges. So chemotherapy can stop this cell division and proliferation, and anti-cancer drugs like the vascular endothelial growth factor inhibitors, or VEGF inhibitors, stop the growth of new blood vessels to stop the supply and starve the cancer cells. And some common ones are those monoclonal antibodies and tyrosine kinase inhibitors, but they're not great for wound healing because we want those new blood cells. So those medications can certainly affect the healing process. Smoking and nicotine can cause vasoconstriction and can reduce the blood supply to the wound area and is a higher risk for infection. The final phase is remodeling. So this is where the wound has essentially closed up, but it needs new extracellular matrix strengthening and build up of collagen to help strengthen the new tissue. So medications like corticosteroids, NSAIDs, and antibiotics can affect this remodeling process by affecting the strength of the collagen and can weaken the new tissue and sometimes cause the wound to open up or become delayed in terms of that final stage, and that can take up to 2 years. So it is a very long time, the healing process, including scarring if it is a slightly deeper wound as well. This is a good image from this article or paper called Negative Impact of Medications on Wound Healing from the Wound Practice and Research, and you can refer to that for the details on those medications and how that affects the wound healing process. But as we see mentioned, NSAIDs and anticoagulants can affect this coagulation process. Antibiotics can actually reduce and affect the production and proliferation of fibroblasts. So judicious use is important because of antimicrobial stewardship, but also because it can potentially delay wound healing if it's not used appropriately. Chemotherapy, as we mentioned, can affect all of those factors like growth factors, as well as angiogenesis and the creation of new formation of new blood vessels. Immunosuppressants and even anti-diabetic medications like DPP4 inhibitors can affect the immune cells, which are really essential because that's what we're going to rely on to help our body heal the wound naturally.